computer is picking up a strange signal. Here, sir, you better take a look at it.
Hello dear listener, and welcome to episode 55 of Life Through a Prism with your host Rob Tierney. In this episode we're going to take a look at an article from qnews.com.au entitled ABS Releases First Ever Estimates of LGBTI plus Australians. Linked to topics discussed today will be in the show notes. This was written by Sarah Davidson on the 19th of December 2024. The Australian Bureau of Statistics, or ABS, has released experimental estimates of LGBTI plus populations. These estimates are the first of their kind in Australia. In a new approach, the ABS combined data from nearly 45,000 people who responded to one of four recent ABS health surveys to shed light on LGBTI plus people in Australia. Linda Farrell, ABS Head of Health Statistics, said, "The new data shows that about 4.5% of all Australians 16 years and older are LGBTI+. That's over 900,000 people. Younger Australians are more likely to be LGBTI+. Nearly 10% of Australians aged 16 to 24 years are LGBTI+. About 740,000 Australians are lesbian, gay, bisexual, or use a different term to describe their sexual orientation. That's 3.6% of Australians. 1 in 3 LGBT plus Australians are married or in a de facto relationship. Nearly 1% of Australians are trans and gender diverse. This includes trans men, trans women, and non-binary people. That's around 178,900 Australians. About 0.3% of Australians report they know they were born with variations of sex characteristics. That's around 63,300 people, as Fardell said. The Australian figures are very similar to New Zealand's 2023 census data. As in Australia, 3.6% of New Zealanders are lesbian, gay, bisexual, or use a different term to describe their sexual orientation. Around 0.9% of Australians and 0.6% of New Zealanders are trans and gender diverse. The 2026 Australian census will include questions on gender and sexual orientation for people aged 16 years and over. This will provide more detailed data by geography and population characteristics for LGBT+ and trans and gender diverse populations in Australia. The next item we're going to look at is a statement that was made by People with Disability Australia in regarding to the announcement by the Australian Federal Government it is going to implement a national action plan for LGBTQIA+ health and wellbeing. People with Disability Australia, or PWA, welcomes the Australian Government's release of the National Action Plan for the Health and Wellbeing of LGBTQIA+ people 2025 to 2035 as an important step towards equitable healthcare for LGBTQIA+ people with disability. PWA, the National Disability Rights and Representative Organisation, and PIC for LGBTQIA+ people with disability, believes the framework has potential to deliver meaningful improvements, but progress will depend on how it is implemented. This action plan acknowledges many of the barriers to care faced by LGBTQIA+ people with disability, and we're encouraged by its recognition of the importance of lived experience in shaping policy. However, the plan's strength will depend on its implementation, and PWDA will continue advocating to ensure these commitments lead to real change, said PWA Interim President Trinity Ford. PWDA has particularly welcomed the plan's recognition of the intersecting identities and needs of LGBTQIA+ people, including those with a disability. LGBTQIA+ people are not a homogenous group. We have diverse identities. The recognition that disability-inclusive approaches to LGBTQIA+ healthcare is a necessary and important step for our community. Its emphasis on lived experience, improved data collection, disability-inclusive workforce development, and reducing barriers to care is commendable, as Ford said. While supportive of the potential this framework holds, PWDA stresses the need for robust implementation to ensure the plan's strong principles translate into meaningful improvements. When the system is not accessible, we miss out on care, medicine, and procedures that are important for our safety, capacity, and to have bodily autonomy. Addressing this will require co-design with our community and investment in accessible service delivery models, PWDA Deputy CEO Megan Spindler-Smith said. PWDA wants to see a particular focus on removing barriers in rural and remote areas for LGBTQIA+ people with disability, as accessibility barriers can be compounded by the lack of healthcare and service providers. Being able to access life-saving and life-affirming medicine and care is a human right. We need to ensure that LGBTQIA+ people, no matter their location or support needs, have genuine choice and control over their healthcare and bodily autonomy, said Ms. Ford. PWDA will be advocating for an implementation plan that is disability inclusive and contains clear timelines, accountability measures, and detailed actions of progress, the full elimination of forced medical procedures with a particular focus on people with innate variations of sex characteristics and intellectual disability. Improved access to essential medicines, including hormone replacement therapies, with a particular focus on increasing pathways for easy access to these medicines for people with disability in rural and remote areas. Integrated action plans for disability inclusive approaches across government services and policy frameworks. Our communities deserve more than promises. We deserve transformative change. PWDA stands ready to work with the government and LGBTIQA+ communities to ensure there is an effective implementation of this framework and its potential is fully realised, Ms. Spindler-Smith said. There you are, dear listener. What do you think? Are you surprised by the number of Australians who identify as LGBTQIA+? What do you think of the government's plan to better the outcomes, better services? Do you think it's not going to make a difference? A talk fest with not much to happen over the 10 years? Do you think it will make your life better? Would love to hear what you think. Let's have a conversation. Till next time, dear listener, take care and bye for now.